Hi, everyone. We are so sad that we aren't able to be with you in person at the APP meeting this year. I attended last year and it was really a fun time. So I am here with Dr. Pulliam, Samantha Pulliam, also Mandy. You'll hear us back and forth between our names. She is the Chief Medical Officer here with us at Renovia. I head up medical affairs and clinical advocacy, and you see by my background, I'm also a physical therapist. And this is our pivot to try to take what we were going to do in our hands-on session with you at the APP meeting and bring it to you in this virtual format.
Nice to see everyone, or not see everyone as the case may be. We are going to do our best here to make a valuable presentation for you, tell you a little bit about our product and a little bit about how we think it will be helpful for you and for your patients. So let's get started.
Definitely. So we covered the introductions just in brief, simply by background, that each of us have a clinical background of many years that is in the space of, for me, pelvic PT, really focused on women's health and working closely with urogynecology and with Mandy as a urogynecologist. And it is that background that really formed our decision to join Renovia and be a part of working on the development of the product, the Ieva digital therapeutic that we'll talk about, as well as several others and some clinical work, and the chance to do that together as a bit of a contribution, I think, to our field and our space.
That's right. So we're excited to talk about this and the new features that we're bringing to our app and our device. In part because I think we have a real hope that this will be useful, that it will be helpful.
Definitely. So we're going to cover a bit of background here at the beginning. This is without a doubt familiar to everyone, but it's just a chance to level set a little bit and say this is the thinking and a lot of the data and really like the cornerstone around which our efforts have been built. So I want to walk through a little bit of just this background on pelvic floor and pelvic floor muscle training. As everybody knows, the female pelvic floor is arranged in multiple layers. It has a breadth and a depth to it, and is a really fascinating area of the body for study and really important for function. We know that the pelvic floor muscles provide support to all of the pelvic floor structures, or the pelvic structures, the support to the bladder and urethra and the vagina and the rectum. And they also play a real key role in supporting the continence mechanism, in part by this dual function they have in being able to have involuntary muscle contractions. So this way that they are turning on, turning off, modulating their activity kind of in the background, behind our consciousness, and the ability for us to activate them and train them through voluntary contractions. And you see this word mass contraction on the slide, meaning that we can dissect these out and name their individual parts, but that the totality of a pelvic floor muscle contraction is understood to be one where all of those muscles are activating at the same time. They are producing a combined upward motion, so a lifting motion, and a squeezing motion. So we frequently call a lift and a squeeze. The squeeze certainly is sphincteric in nature when we look at some of the more superficial layers of the pelvic floor, but there is a squeezing vector that comes from the levator ani that is more of a horizontal translation. So the levator ani, this workhorse group within the pelvic floor, activates under voluntary contraction, produces a lifting motion, as well as a compressive force directed anteriorly that provides compression to the urethra and some elevation toward the bladder neck. And this is really important when we think about how we are trying to direct feedback for pelvic floor muscle training and our understanding of the basics of, am I doing a good job at this pelvic floor muscle contraction or not? So moving on to the next piece of this then is just kind of a level set statement about pelvic floor muscle training. I think that it is really easy for this to get, kind of flippantly referred to as, oh, just do your Kegels or just do your Kegels. But when we understand the definition of the training regimen, it is a collective of exercises, and they can have various goals for improving really overall the function of the pelvic floor, and it's through targeting strength, endurance, power, and or the relaxation of the pelvic floor. So that all of those are components of training and may be variously employed based on the needs of a patient. When we look at pelvic floor muscle training, we have a really pretty large body of literature on this, and consensus has boiled down to a few things. One is that the evidence is sufficient for this to be recommended as first-line care for women with urinary incontinence. Also, that the best outcomes in pelvic floor muscle training have resulted from close interaction with a skilled healthcare professional for a period of approximately 3 months or up to 12 weeks. So those are some of the things that we kind of can distill. We can, boil everything down and pull that out. With regard to questions of does it work or how well does it work, there is a lot of heterogeneity in the interventions and in how it is studied. But one key review pulled together data on men and women and looked at cure rates for incontinence, broken down by gender and by sex, as well as by different types of incontinence. I pulled out here just a few of their stats that the best findings were, and I think that this is not surprising to our group, the best findings were for stress incontinence, that they defined a success rate, meaning complete continence, dry, of almost 53%, and that there was about 25% complete cure for women with mixed urinary incontinence, and that those numbers continued to improve over time, so that when they had data up to 12 months, that there was incremental improvement for people at 6 months and 12 months. However, in looking at all of that data, as well as a few other papers, there really is still no consensus on pelvic floor muscle training program design. So the types of programs are variously designed, variously implemented. So we have a few things that we can say most people agree on these pieces, and that there is still quite a lot of variety in the way that programs are designed and implemented both clinically and in research.
Right. It's interesting listening to you talk. It occurs to me that the recommended length of time for pelvic floor muscle training is longer than quarantine, at least.
Wow. I think that's a bit of perspective that I had not put on. I'd not layered those together. Yeah, you're right. It can be a big ask. And having been one of those people who's saying like, this is what I'm asking you to commit to, it can be a long ask of people for sure. So the next piece we just want to make note of is the concept of biofeedback as an assistance to pelvic floor muscle training. Biofeedback, we'll talk about the definition here, but I think one of the early questions that I got a lot, and Mandy, I don't know if this is what you got, but was really, is this just another thing? Like, how is this different from anything else? Is it really just another biofeedback device? I will really just come out and say very clearly that I didn't believe that it was. I still don't believe that it is. And it's, if I had, it wouldn't have prompted the kind of career move I made to come and be a part of working on this development. So I want to talk a little bit about biofeedback, because again, I think there are these terms that we've heard so many times, and it's really easy to say it, and either I say it and I assume, Mandy, you know exactly what I mean when I say it, or I think I know what I mean, and maybe it actually is defined a little bit differently. And so that's why I wanted to bring this definition onto the screen of the Cochrane, has several papers looking at pelvic floor muscle training and biofeedback. But when they were investigating biofeedback, this is what they defined, that it's some type of feedback of a biological signal that enables us to identify and modify a bodily function of which we're usually unaware, right? So biofeedback is not even exclusive at all to the pelvic floor. I think that those of us for whom that's the fishbowl where we live, then that's what biofeedback is. And like biofeedback truly is across the totality of the healthcare experience. Like it can be manifest in lots of different ways. And it's just a way of taking some signal from the body, translating that into some type of feedback for the individual. And they use that to say, okay, I understand what's happening in my body a little bit better. I know I need to tweak something a little bit, you know, like that's how it's internalized and used. Really key in understanding biofeedback for the pelvic floor specifically, and in these investigations, you know, in the Cochrane reports on how we look at biofeedback and understand it, and if it's useful, does it have utility for pelvic floor muscle training, is they identified 3 primary biological signals for looking at this. Okay, so when we talk about biofeedback, I think it's real easy to assume it's one type of signal, that biofeedback is equivalent to a CMG, or it's equivalent to perineometry. And it really is a parent term. So you can deliver biofeedback via EMG activity. You can deliver it via squeeze pressure, so by perineometry. But in this report in 2011, they introduced movement as a different type of biological signal that may be efficacious, may be useful to us in the field for providing feedback on pelvic floor muscle activity and motion. This was the first time that I saw it introduced like this. We had, you know, well over half a century of data to look at on EMG and pressure data, but very, very new information. And the movement that they talked about was in the context of ultrasound. The last point here is that then when we think about devices, it's just going to be some type of, you know, device that records a biologic signal. So in that sense, part of what we're doing is, yes, it's another biofeedback device, but it's that and several other things, which we'll talk about. Cochrane reviews have shown that, you know, biofeedback can be very helpful, but so far that there has not been anything that demonstrated increased benefit over and above the calls for working with a skilled healthcare provider for a period of time. So with that, I'm going to ask Mandy, if you have anything to add so far, please do. And then if...
You know, I think that one of the reasons that we often hear the question about, isn't this just another biofeedback device, is because there's a lot of doubt out there about biofeedback, what it's meant to do, and how well it works, frankly. And I think, Jessica, even the Cochrane that you just shared sort of underscores that. So I think part of what I think about when I think about why this device is unique is 2 things. One is the uniqueness of the movement sensors, and the other is the value of that, plus the value of the digital health capture that we have. So I just want to start by talking about what makes this thing unique, what makes Lead unique. And I think, I don't know if I can forward the slides. Can you?
No, you can just give me the next slide cue. There we go.
So this is a picture of the device, and I actually have the device for what it's worth to show as well. Looks just like it does in the picture, I guess. But I want to show it to you because I want you to see, you know, how flexible it is and how easy it is to reflect motion. So what happens with this device, and the thing that makes it different, is that it has in it sensors that reflect movement. So this device gets placed in the vagina. You can see it's a very small device, and it's not difficult to place in the vagina at all. But what happens once there is that if you ask a woman to lift and squeeze the pelvic floor muscles, the vagina moves in response to the motion that's generated by a lift and a squeeze of the pelvic floor muscles. The sensors inside basically demonstrate that motion. As the vagina moves, the sensors move. And that allows the projection onto the screen of the actual motion, the actual result of squeezing pelvic floor muscles, so that you can see whether you're moving them or not, whether anything's happening. And I think this is a common question that I hear when I ask women to do Kegels if I'm performing a pelvic exam, and they say, is anything happening? And here you can see what's happening. And not only can you see that something's happening, like muscle depolarization, but you can also see the directional nature of it. So is there a lift and a squeeze? Or as you might see sometimes when you examine patients and you ask them to squeeze, are they actually doing sort of a Valsalva, or are they bearing down instead? So these motions can be seen because the sensors inside here show motion and it's directional. Why don't you go ahead to the next slide?
Really quickly, while you have it in hand, could you just demonstrate for people the portion that would be inserted versus the portion that's still out?
Absolutely.
outside
So
of the body.
purple part here, I'll move closer. The purple part, and this is not a button, that's an on and off button. It's just a guide so you can understand how to place it properly. But that's the portion that's outside the vagina. The portion that's inside the vagina is really this part here, which is probably about 7 or 8 centimeters long. That would be placed inside the vagina. So it's not very much that's placed in the vagina. And also, just you can see here, the width and the size of it is small enough, frankly, that anyone of any vaginal caliber who has a vaginal depth of probably greater than about 3 or 4 centimeters is able to use it and place it.
Great, great. Thank you. So there's our next one.
So here's the technical part of this conversation, and I am happy to geek out about this a little bit, but I think telling you a little bit about this will help. First of all, just to explain the picture on this slide, what you see there is the head of a match, and sitting on the head of a match is an accelerometer, and these are the sensors that are inside the device that help to demonstrate motion. Go ahead to the next slide. So this slide explains what happens here, right? So again, you see the head of the match there, an accelerometer. Accelerometers have been around for a long time, really since the 60s, and they began to be used more often when things like smartphones became such a big deal. Right? So the way to understand what an accelerometer does is if you think about how the phone that you have in your hand changes from portrait to landscape when you're reading, if you change the orientation of your phone. Accelerometers sense the position of a device, of itself, really, relative to the Earth, right? So the force of gravity acts on the accelerometer, and we know that that's an acceleration, right? So it senses the push of the force of gravity. What happens is that the orientation of this accelerometer changes. So if someone performs a lift like this, the angle at which the accelerometer is facing the Earth changes. So we know the distance between each of the small accelerometers in here, and when the angles change like this, we can then create sort of a linear representation of what happens when the angles change relative to each other. This will be a fun slide for you to read later when you freeze the picture and have a look through. Next slide. So here it is, right? Here you can see the angles over on the left side of the screen, the measurements, and then the depiction of what's happening on the right side of the screen. I think in a minute we'll show some motion so you can sort of see how that goes. So this is a picture of one of our devices that's inside the vagina. It's a little different than the device I'm showing you here, but the motion that you'll see here is the same.
Yeah, so just as you're trying to orient yourself, this device is within the vagina. This is a graphical representation of where it would be sitting. So we would have the pubic symphysis here, bladder and urethra. Here's the vagina, and then behind this would be the rectum. So as you watch this contract, you're going to see all of these moving, and think back to those explanations about how the pelvic floor works in mass for both lifting and squeezing. So if you think back to our math classes, it's like rise and run, right? Like there's a lift, there's a rising action, and there is a linear translation particularly to the PTs in the group that might be watching this. Think about the difference between detecting a concentric contraction versus an isometric contraction. So I just want to plant those seeds for you before you watch this.
So this is a woman who is performing lifts and relaxations, and you can see it happen very clearly. And I think, actually, when I saw this for the first time, I thought this is so intuitive. You can see what's happening here. So this is not the same idea of what you would see if you were looking at something that measured pressure. You could see the increase in pressure and the decrease in pressure. Here you can actually see directional motion, which I think is exciting.
Right. I agree.
Right.
So the last thing that I want to ground us on then here is why we're calling it a digital therapeutic. There's a little bit of language around that I think is important to unpack before we finish with our faux hands-on time at the very end here. And so we're calling this a digital therapeutic platform, and part of that is that for anybody maybe that was with us last year at the session, you might remember our first generation device, which was more of a cylindrical probe. It had a white wire and a transmitter box, and so when we talk about device, the physical device of this this therapeutic has undergone pretty significant design improvements to improve usability, aesthetics, to have a protective carrying case. And we've redesigned the app truly with a therapeutic intent, even more in mind, and have designed a reporting structure and platform that takes that data and can make it actionable both for the user as well as for the involved HCP. The core technology has been patented, so when Mandy's explaining the use of the accelerometers for this purpose, we're fortunate to be granted that patent, and it has been 510(k) cleared. So it's FDA cleared and will become available. We just heard this morning that by the end of this month, we should have our very first commercial users using this device. So we have done a bit of clinical work and have had a pilot RCT that was conducted with earlier versions of this form factor, and we'll be using this in some future clinical work as well. So digital therapeutics, you'll see at the top, this talks about it being in the gap, but allow me to define it first. So if you had not been hearing about digital health, prior to mid-March, you probably are now, and maybe trying to figure out what you need to learn about it. So digital therapeutics is a new and emerging subset within digital health. So there is this large umbrella that consists of digital health and multiple types of applications and uses of technology for the purpose of health. Something enabling health fall under that, and digital therapeutics is one of those. Again, really new, but a few of the key features are highlighted here. It is that the evidence of a field, the evidence surrounding a health condition has been harnessed, and through technology, it is being used to either prevent, manage, or provide treatment for a medical disorder, a health condition, or a disease. So there is a lot of latitude in how digital therapeutics have been designed and how they're being delivered. They may happen in concert with medications. With ours, it is a combination of a physical device with an app and with some human interaction. And it may be even multimodal, so that digital therapeutics generally may be done in combination with other types of interventions. But this highlighted, bolded piece in the middle is really important when we think about how this applies to what we're doing in the context of primarily treating female urinary incontinence, is that digital therapeutics as a category have the aim of really elevating best practices. So something as best practice has been identified, but yet there are unmet health needs, but yet there's a need to expand healthcare access, and to be able to do that through the improving of health and clinical outcomes. So being able to study the outcomes as somebody is using this therapeutic that is digitally enabled. So when we think about the care pathway in part, but kind of the practical nuts and bolts of care execution, we said early on that this pelvic floor muscle training should be first line for people, that it should be with a skilled healthcare provider. But work of our group and work of other groups has shown that is sorely not what we're achieving. Multiple studies have found that within the US, it is single digits percentage of women who are diagnosed with urinary incontinence and actually making their way to see somebody for pelvic floor muscle training as first line. So that's something we'll talk about more in the other webinar that our team is bringing into this platform. But what it means is that there is a major gap in terms of the numbers of women with bothersome urinary incontinence, the things we know that can be done for that group, and how we're actually meeting their needs. So that's the concept of digital therapeutics, something that is taking the best evidence we have, leveraging technology and digital health to the best of our ability to be able to scale the access of that therapy. And here we're applying that to female urinary incontinence. So last note here we've touched on this a bit, but when we think about this as a digital platform, this is, yes, the physical device, the lever that the woman is using, that is measuring something that is happening within the body and providing her some feedback. But the interaction there with the phone is capturing the data of her training. It's capturing additionally some, therapeutic markers of, filling out symptom questionnaires and avoiding diary, and capturing all of that information securely in a central server. And that serves two primary purposes when we think about this as a therapeutic. One, in that we are able to then reflect that information back to the woman who is using it so that she can see, how am I doing with this? How, am I getting better? What else do I need to know? How do I compare to other people? And that is a way of keeping someone engaged with the process. And then the other is to be able to take that information into the reports that are going out to physicians and other healthcare providers who are involved in her care so that they can get periodic progress reports. We really believe that this is something that is of value and will help in keeping people on this path to care. I know that there's a lot of attrition, right? I mean, that's something that Mandy and I have each experienced in clinical practice and have studied, and feel like there is often this kind of break between telling somebody what they need to do and then the plan for follow-up. And that if there is this way of digitally messaging both the person who is using it, the woman who's receiving care, and her supervising provider, so that they know we're getting this information on this path and we have a plan to come back together to discuss it at the end, can be really powerful for helping move more people along.
And I think in a way, the COVID crisis has really brought this into great relief. I mean, for better or worse, I mean, urinary incontinence has not been a critical health need. So women have been experiencing urinary incontinence and have had nothing that they can do about it because they haven't been able to leave the house. And yet, one of the things that this represents is a real way for women to be at home, if they're at home or wherever they are, and not have to come in to see their provider make progress or even to communicate with their provider regarding So we think this is really timely in the sense that this allows women to have a care opportunity that can be supervised. Yes, they never have to leave their home. And what an opportunity that is in this era.
Right. Yeah, great.
Okay.
So
here we go.
Here we go. So up next, we've got just a few slides where we have some videos to show you a bit of a navigation around the app, because we said we have an improved device, but the app itself has been designed with therapeutic outcomes in mind. And there are a lot of things that go into that. Part of it is how easy or hard is it for someone to get started doing an exercise? Do they believe that it's a benefit to them? And how is information getting reflected back to them? So we have a few here. We're just going to walk through. We can pause and discuss this as we see it. But we want to show you what happens when somebody's getting started. So we're going to see graciously Mandy enrolling as a first-time user during some of the testing that we've been doing.
So you might learn a lot about me here if you look closely. So
she has very cute puppies.
These are just like downloading other apps. So here's the Ieva app, and then you can sign up if you can type, providing just basic information and a sign-in. And this allows a unique account to be created that is a sort of basis for collecting kind of information that allows us to communicate with the healthcare provider, allows a woman to understand and be able to track her progress. So another important thing to say here is that this is a very secure process. The data is encrypted and secure. There's a long list, as there are on any app or any device, of permissions. So as we take you through this, you'll see all that. We protect your identity by having a 4-digit code here, like you've seen with many other sort of secure things. There were my puppies. And this code gets sent to your email so that there can be a two-prong security And so here we are. So once you enter the app, then the device gets connected. So I've got the device over here in the corner, and it's now connected to the app using Bluetooth.
One really nice thing that we did there is improve that pairing process. In our first generation app, it was a very manual process, right? To pair the Bluetooth. And now it is such that you take it out of the case and open your app and they find each other. So as long as you've granted the Bluetooth permissions, and that is great. So again, one way that usability has been improved.
I think we're ready for the next one.
Yeah.
All right. So this is the main screen for Ieva. Right. So this is what you would see if you opened the app. And just to point out a couple of things here, up across the top, and you can see that I made this video on a Thursday. So the Thursday is circled there. And you can also see that one set of exercises has been performed. The way these exercises are done is for 2.5 minutes twice a day. So just a quick view here allows someone to track their progress and see very easily what's going on. Then in the middle, under training progress, is an area where there will be, over time, a graph that tracks progress and shows women how they're doing in terms of performing their exercise. And then a couple of other things that are visible here. One is a symptom diary, and we'll show this to you, but we've basically incorporated a bunch of important, I think, for clinicians and important also for women, symptom tracking options, including avoiding diary and including the validated scale called the Urogenital Distress Inventory, short form, or the UDI-6. And then a final thing that women can track is how many pads they use. The big purple button there is how to get started with the training. And then this is what happens. You get taken through a series of instructions so that you know what to do and how to use the device, how to orient it so that it's properly placed in the vagina. Even if it's not rotated properly, the guide will show you what to do until it is rotated properly. This is the rest screen. Jess, we should stop and talk about this because I think it's really important. One of the challenges with traditional Kegel exercises is that we don't really talk about anything but the squeeze part. And I think it's important to emphasize here that in any sort of muscle exercise, there are two aspects of it, probably at least. I should probably defer to the physical therapist here, but there's relaxation, so that the pelvic floor muscles are ready to squeeze. They're elongated. And then there's a squeeze. So this rest screen is really unique to our device in terms of instructing someone what it is to relax pelvic floor muscles, giving cues about how to do it, and visuals about whether it's been done or not. So in this device, the rest and the squeeze phases are balanced and separate. And I think this is very exciting. It's therapeutically correct, and it's an opportunity to help women focus both on the relaxation and on the squeeze. Here we go. So there's a rest, and then this is the squeeze part. So here, we call this the windshield wiper, I think for obvious reasons. But what you can see is, if you imagine that a woman is facing to the left of the screen, the device in the vagina, so this way, and she's lifting and squeezing. And that was an example. This was part of the training phase. So this is a series of training opportunities allowing a woman to understand how to use the device and how to perform her exercises. So here it is again, and there are a couple of things on here, right? So you can see the pink portion of the windshield wiper, which would be what was happening if one was bearing down. And you can also see the purple portion, which is where one is if one is lifting. We'll see that again here just in a second. But when you lift, there are two parts of this little windshield wiper that become visible. One is the big dark bar, and that's the actual device itself. That's what you're seeing with the actual device. And the other is the sort of the smaller bar that is the device, that the portion of it that shows how far, what's the highest that one is lifted during an exercise session. So that's what you're seeing there.
I was working on pausing something for us and accidentally advanced to the next slide.
Well,
Sorry about that.
Okay.
So it goes through.
Yeah.
But this one, I did want to say this was a nice correction that we made in the design of it, to be able to figure out so that people could know if it got out of place or wasn't placed correctly. Because again, that's one of the things that people want to know, like, I don't know, is it in right? Like, am I using this thing right? That there is a way that because of these MEMS sensors, they are smart enough to know, they detect their position and can tell where they are and correct her. So that was a really great add compared to previous version. And as we go through, we've talked about this one a bit. But I'm going to bring us up to, we're on like number, yeah. So we're here, I think, in talking about how that, you know, the lilac and, you know, kind of pink barrier is our start position. So it's become so clear, like if you are bearing down and going into that pink, that it's not the correct thing, or if it's not lifting at all, that someone's not able to lift up.
You can see, as I was mentioning before, the lighter dotted line, which will give someone a goal and also help them understand how high one's lifted during any single exercise session. You can see the degrees up there too, and that's really about angle change, which is what our device is based upon. So you can see how much you've lifted.
And with that, that's where the reflection is, you know, when you talk about that degree of lift. All the PTs that might be listening to this, think about your goniometers. This is literally, you know, angular displacement in space, and it is reflecting back just on the previous contraction. And then she gets a summary score at the end. So counting endurance as well as the excursion of the contraction.
So, and this is a great screen. This is a screen that allows women to understand how they've done during their exercise session. So how many degrees on average they lifted. And then maybe more importantly, how they compare to others who are going through this process as well. So actually you can see the person who did these exercises was well above average for week 1 users for the average lift, but within the range for the average hold time. You know, I think this screen underscores a couple of things. I mean, one is that being able to understand performance against some benchmarks, against some data that really looks at how users are doing when they compare to all other users, and over time that will be more and more women, we think, really helps her to kind of couch who she is, right? So a lot of times people ask questions, how do I know I'm performing exercises properly? How am I doing? I've had many women come back into my practice and say, can you test my pelvic floor muscles and tell me how strong I am now? So this is an opportunity to see that after every single exercise session. I think it's really helpful and motivating. So I think it can provide healthcare providers an opportunity to understand a little bit more about their own patients. How are they doing compared to others? That's not something we have much of an opportunity or a window in.
Yeah. So this will be the last video here. And this, I believe, is going to take us into showing us another feature called practice. Part of why it's pairing, but I believe we're going to go to symptom tracking first.
Yeah. So maybe we can pause here for a minute. These are, as I mentioned before, a couple of the opportunities for women to collect data. So the data collection, and women are reminded to do this. It's not that we ask them to do it every day. I think people find that annoying, frankly. But we do want to track changes over time. So we ask women to do it as a baseline, how many times they leak in a day. And then over the course of the next few weeks, do it again and again, so that there can be a comparison over time. Where did we start? Where are we going? How are we making progress? So that's for leaks, for trips to the toilet, for changes of pads, and also the score, the UDI-6 survey.
So this will expand just a little bit and show us, you know, when we do changes, that's going to be quantified. And that's where the numbers will show up for the UDI-6 score. So here's where we're going to head into practice. So this can be a useful thing for women who are maybe just wanting to play around with it a little bit more and try things out. Or we've had a lot of folks who are doing it under supervision with a physical therapist, with a, you know, an NP, or with you know, someone else, and they are looking to practice that without recording testing sessions. So it kind of moved as quickly. I can go back. Okay, here's where we track the leaks.
So this is one of my favorite parts of this. This is actually a built-in voiding diary of sorts. It will come up once every couple of weeks for someone to record for 24 hours. And it's pretty simple, right? I mean, here's what happened. You can see it's very visual. Was it a small leak or a large leak? Did you have leaking with urgency? Did you leak on the way to the toilet? And was it caused by activity? So these are some simple questions that actually provide answers that really are the essentials to a voiding diary that has value and meaning. And you can see actually that each one of these things, and here's the changes, right? But see the today's symptom diary here in the lower portion shows leaks and changes and toilet trips. So these are really essential bits of data, and they're very easy to record. Just tap on the screen and now record it. And since, for better or worse, we know that most people have their phones with them at all times, including the bathroom. You feel pretty excited about the ability to collect real-time information with this, which is really one of the essential elements to an accurate diary.
Right.
So here's another really great part about this app is just the opportunity for education, right? So contained in here are 6 panels that go through the essentials of the pelvic floor muscles, the pelvic floor muscle function, what's a proper pelvic floor muscle lift and squeeze, and what's improper. And examples based on what they would see on the screen of the Ieva device so that they can understand. Further education shows how to use the device, what is composed, what's a training session, what's the device all about, what do the angles mean. So we have everything in here that will help women understand kind of what they're doing and how well they're doing.
That
so
brings us back.
Might bring us back to the end.
It does.
I think that we have, oh, here's one more piece. Part of what comes with Ieva is support. You know, one of the keys about supervised plans of care are having those touch points where you have an opportunity to talk and get feedback from people about how well you're doing. So we provide that in 2 ways. Of course, if there are technical concerns or confusion, and you may imagine that not all of the women who might benefit from this device are incredibly technically savvy. Some are. So we have technical support for the use of the device. And then we also have our Renovia educator team. And these are women who are dedicated really to helping women understand about pelvic floor muscle exercises, helping them use the device properly, and really giving pointers and holding women accountable in a very personal way as they work through the training session. So these benefits are included with every prescription for Ieva, and I think really make this device stand out in terms of an opportunity, because not only are patients getting the app and the device, but they're also getting really someone to help them, someone to be available, a human person to speak with as they go through the sorts of training that this allows them to do at home. And I think that's a fantastic opportunity.
I agree. I agree. And that was it. That was the end of the screen, and I guess the end of our hands-on portion, virtual hands-on.
So even though we're not all together at this conference, I want to make clear that everyone understands that we're available to talk about this if you want to. This is a great opportunity for your patients and for you. And if you have any questions or if there's anything we can do to help you kind of figure this out, or really anything else, we're happy to talk, and we're pretty easy to get.
Absolutely. We'll make sure our contact information is available, and I know we have a colleague who will be manning the chat session, and we hope that the whole of this conference is a great experience for you, and we look forward to being able to reunite in person when that's permissible.
And if you need us on the chat session, I think we are going to be available at certain points in time, so don't hesitate to make an appointment to talk with us through that. We'd be happy to talk.
Absolutely. Great. Thanks.